Anong mga tao? What's up, people? I'm back again for podcast number 11. This podcast is called the Outbreak series, and it's where I talk about the coronavirus or COVID-19 and its spread through the United States and into my state of West Virginia. The last time I talked to you guys, and I'm Taylor, by the way, if I didn't say that. Now, the last time I talked to you guys was on Wednesday, April 1st. I know it's been a while. Sorry about that. But here I am, okay? So, when I talked to you on April 1st, the numbers were United States total confirmed cases of the coronavirus were right at 200,000 people. Deaths, 4,394. Hotspot, epicenter, New York, New York State, Jersey, DC, my hometown, 586 confirmed cases. West Virginia, my current situation, 191 confirmed cases with only 4,500 tests given. So we'll compare that to today. And today is Thursday, April 9th. Podcast number 11. So, United States up to 465,000 confirmed cases of the coronavirus. Deaths, 16,510. Hotspots, still New York State. We have some other hot spots getting hotter and hotter and hotter. Jersey, obviously. Louisiana, very worrisome. And Michigan, very worrisome. Okay? Talk about what's happening there a little bit later. And my hometown of DC, from 586 on April 1st, now it's at 1,523. And then West Virginia is at 523. And they've definitely improved on their testing, because the last time I talked to you, they had given 4,500 tests. Today, they've given 13,800 tests. So that's good. That's good. It's better. It's better. Much better. So I do want to touch on one thing that's kind of that's been in the news a little bit. In something that I didn't think about at first, and I don't know why I didn't think about this. But we're finding out as numbers come out, of deaths in cities and this and that. But the minorities are taking the brunt of this coronavirus. The black people in the cities are taking the brunt of it, and that's in Detroit, that's in Chicago, that's in New Orleans, and that's trending in each city, inner city. So just want to talk about that a little bit. First of all, let me just give you one example. Frontline workers are 70% of the population in New York. Okay? So frontline workers are not just nurses, doctors, but they're also people that work in restaurants, or that have to work, or grocery stores especially. Frontline workers. All the people that are out there working amongst the coronavirus, okay? So frontline workers, just in New York City, make up 70% of the population. That's black, brown, Hispanic, whatever you want to call it. And typically some of those frontline workers are at their lower end of the economic status. So they have to work, because they have to be able to eat, to feed their kids. They need gas money, whatever it may be. So a lot of these people are out there, working in this environment and getting exposed to the coronavirus, and then exposing others in their neighborhoods or where they live to the coronavirus. Let me just give you some numbers here. Okay, so it started to be noticed in Michigan, where the trend was, black people were getting the COVID-19, and they were getting 40% of the virus, and there were actually 40% of the deaths were also African American or black people. But, so 40% African American or black people, but the state percentage of black people in Michigan is 14%. So that should send a red flag, obviously. You have Louisiana, same thing. New York City, New York is not reporting numbers yet. If I can get those, I will get back to you. But if I had to guess, I would say pretty much same thing. And Illinois, which obviously the major city in Illinois is Chicago, where my dad is born and raised. So listen to this number. Okay, so Illinois, African American or black people are representing 70% of the virus deaths. 70%. The percentage of black people that live in Illinois is 30%. Okay? So, and these numbers, they're not completely true, like to the point, because a lot of times the doctors are not putting race down on the death certificate because there's so many people passing away in some cases, so it could be even higher. But those percentages just don't work. And obviously, you got to think about it. I grew up in DC, and before gentrification in Southwest, 90% of Southwest was hood. It was, the projects, and it was the the row houses, and it was like 90% black back in the day. It's changed now in DC, of course, a lot. But my point is that if you are, if you're Dave, and you're 55 years old, and you've lived in the city, in the hood your whole life, and maybe you weren't doing the right things, but you had to do whatever to survive, to feed your children. Do you think Dave at 55 years old is going to go to the hospital if he feels a little sick? Do you think Dave wants to talk to police officers? No. And neither does Dave's mother, who's 75, 80, who's lived in the hood her whole life. It's a close-knit community, but overall, they don't want to go to the hospital because, first of all, they don't get equal treatment most of the time. So what's happening is they're waiting till the last minute. They're waiting until they're just so sick. All right, I'm going. And then by the time they get there, it's too far gone, and they end up passing away. That's what's happening. And I was even thinking more. How could we have prevented this? And we could have helped this easily. And here's how we could have done this. If Donald Trump, instead of, saying that everything's okay, we have it under control, our president is supposed to warn us when there's an emergency or a possible emergency. Whether he wants to try to keep us calm or not, he needs to let us know. Because what the president says gets printed in the paper, right on the front page. It's all over the news. It's just what it is. So if President Trump would have, been a little bit, I don't know the word. If he would have been a better president, then he could have just said, listen, there's a dangerous virus out there, okay? In January, he could have done a thing on national TV. I don't know. I hope it doesn't come here and doesn't affect us. But there is a chance it could. Here's what we know, you know. So if Trump would have said that, it would have been in the paper, you know, then community leaders would have heard that and would have gone out in their community and spread the word to 55-year-old Dave and his mom that don't want to go to the hospital. Well, listen, if this thing does come here, the best thing you can do is wash your hands a lot. Practice social distancing. Be aware that it could be here. It could happen. Okay? That could have saved thousands upon thousands upon thousands of lives in all these inner city areas where you have blacks, Hispanics, people that live there that are on the lower end of the economic status, that have to work. You know, a lot of them don't even watch the news. You know what I'm saying? I mean, maybe they didn't know. But all Trump had to do was just sound the bell, sound the alarm, and just say, hey, it may be, but it may come here, but I hope not. You know, let's get your community activists to go around, knock on doors, pass out pamphlets, give information stating what to do if it does come. That was never done. And now you have cities like New Orleans, New York, Detroit, losing thousands and thousands and thousands of black, brown, Hispanics. It didn't have to be that way. You know? Okay. You know, and Trump makes the excuse, well, he didn't know, whatever. Okay. He did know. His advisors knew. Peter Navarro, the White House trade advisor, actually sent 2 memos, one in January, one in February, saying that a pandemic was possible. So, no, Trump knew, okay? He screwed up, man. Screwed up. And now loved ones are being lost because of it. All right, so I'm going to take that back to make sure you're doing your social distancing, washing your hands, watching the news. Okay? All right. All right, well, enough about all that. So I did do a podcast that I never uploaded this week, and I talked about some. I just wanted to be positive. I was tired of talking about numbers, deaths, this and that. So just talked about some positive stuff. So what I'm going to do is I'm going to take a break real quick, and I'm going to show you a clip or two of that podcast I did right outside there in my little tent village that we've had on the deck. So check this out, and I'll be right back with you. All right. So, you know, we pay all that money for Netflix, for Amazon Prime Video, Hulu, cable, whatever it may be. We are getting our money's worth out of all of that, whether it be internet, cable, whatever it may be. We're finally getting our money's worth, aren't we? Thank goodness. Oh yeah, and then one more thing I'll mention. I'm gonna make this quick. I'm sitting out here on my deck. By the way, if you didn't know, I made a tent city. We got 3 tents. We got a hammock. We got a grill. We got a weight bench over there. We got like umbrella. A lot of stuff. And the good thing about it is, you know, we're pretty much 5 seconds from the kitchen, 5 seconds from a bathroom. So it's great. This is the only way I can get my kids to go camping. If it's right here. So, oh well, there's actually 2 things I want to go over. So, looking through old photo albums or pictures that are saved on your computer, going through all those albums that you haven't looked at in like 5, 6, 7, 10 years even, reminiscing about the old times and realizing how old you are and how fast time goes. That's kind of fun. That's cool. And I thought I had another one. I don't think I do. So comment below. Let me know what you guys are doing. Let me know some positives that you're getting from this, you know, from the shelter at home order. You know, there's always positives from every negative. So I want this to be a positive podcast, and I want it to be a very short podcast, okay? So, love you guys and gals. Keep tuning in. I'm doing good. Kids are doing good. We are appreciating what we have. And although life is tough right now in many ways, you know, you have to appreciate what you have, and you have to be aware of what's going on. And you know, shit is real right now. It is really real. I think Wu-Tang said that in one of the shit is really real. It's true. It's really real. You know, we're down here in West Virginia, and we're kind of sheltered from what's really going on in, you know, those hot spots: New York, Louisiana, Jersey, Cali, Michigan, Florida. You know, it kind of just seems like it's coming in on us. You know, it's just a matter of time before it gets here. But I don't know, maybe our sparse population and you know, our, you know, those orders that the CDC and our government put in place, or you know, maybe the coronavirus will spare wild and wonderful West Virginia. We sure hope so. I sure hope so. And that's all I got. That's all I got. Okay. So have a good day. Have a good evening. And you just think about the positive things, okay, that you have. It's all about positivity today. All right? All right. Peace and positivity. I'm out. All right, guys. I'm back. I hope you enjoyed that little clip. And the tent village is still up, going strong. It's been super windy around here. So luckily I have all the tents nailed down to the deck. So they're not going anywhere. All right, so, you know, I've been bored. I'm sure you've been bored. It's been rough. You know, you have good days, you have bad days. One day you'll wake up and be like, well, I mean, what am I doing? How long is this going to last? This is crazy. And the next day you wake up and it's not so bad, you know. I'm sure, you know, we're all going through it, our ups and downs. But remember, you have to stay focused, stay strong, and you got to keep practicing those social distancing skills and all those recommendations from the CDC as well. We just got to work through it, man. It's going to take some time, but that's one of the reasons I'm doing this podcast, okay? Also, if you guys have any ideas to pass the time that you'd like to pass along, make sure you comment down below. And please smash that subscribe button down on your right side. I need subscribers, okay? I need to build subscribers. So definitely smash that subscribe button. And I just want to leave you with a quote / lyric. Most of you probably have heard this before, okay? But basically it says, don't worry about a thing, because every little thing is going to be alright. Saying don't worry about a thing, and so on. Alright? From our boy Bob Marley. So thanks for tuning in. This has been podcast number 11. Stay safe out there, people. I love you guys. And I'll see you the next time. All right? Peace.
Wow.